When should I start screening mammograms? So there's actually a lot of confusion surrounding this question. This isn't helped by the fact that different medical societies and government organizations just can't agree on a consensus recommendation. At the end of the day, when to start mammographic screening should always be a discussion between a woman and her doctor. But in this video, we're going to review the most commonly used recommendations, as well as dive into the data and the evidence behind the recommendations. So let's start with the guidelines that are most comprehensive and are most commonly used by breast radiologists, breast surgeons, and plastic surgeons. Screening guidelines from the American College of Radiology and the Society of Breast Imaging, updated in May of 2022, recommends annual mammograms beginning at age 40, reasoning that it allows for diagnosis at an earlier stage, better surgical options, more effective chemotherapy, and the greatest reduction in mortality. For women ages 75 and older, screening has continued benefits in terms of deaths averted and life years gained. However, this benefit does fall significantly in the cohort of women ages 80 to 90. Let's move on to the recommendations from the American Cancer Society, which are used most commonly by OBGYNs and primary care physicians. They state that women ages 40 to 44 should have the option to start annual screening mammograms if desired, that women ages 45 to 54 should get mammograms every year, and that women ages 55 and over can continue annual mammograms or switch to screening every 2 years as long as they have a life expectancy of 10 years or more. Lastly, let's review the recommendations from the USPTF. The most recent recommendations were published in 2016 and are currently being updated. The USPTF recommended mammograms every 2 years, also called biennial screening, for women ages 50 to 74, with the option for women who are more risk-averse or who have a first-degree relative with breast cancer to start screening every 2 years starting at age 40. They also concluded that while there may be a benefit to continuing screening after age 75 in women with few comorbidities, there wasn't enough evidence to make a formal recommendation. So let's unpack this and really look at the data. Starting with the USPTF recommendations, there are really several big issues with these. Firstly, they're based off clinical trials that started enrolling patients over 30 years ago. As you can imagine, imaging technology and breast cancer treatments have evolved significantly since then. They also only take into account mortality or deaths from breast cancer, as opposed to considering the morbidity of the diagnosis, which could include loss of the breast, chronic side effects of surgical, medical, or radiation treatment, and very real effects on a woman's life, family, and career. The USPTF takes the potential harms of a screening test into account when doing its risk-benefit analysis, which include false positive results, unnecessary biopsies, and overdiagnosed tumors that may or may not have grown fast enough to have caused any clinically significant harm to the patient in the long run. However, in my opinion, weighing these risks against the mortality from breast cancer is the decision best left to the individual patient and her doctor. Recommendations to delay screening until age 50 are more heavily weighted to adversely affect minority women, as 1/3 of all breast cancers in Black, Asian, and Hispanic women are diagnosed under the age of 50. Additionally, data published in 2011 has demonstrated that annual mammography starting at age 40 has a mortality reduction of 40%, saving 71% more lives than the USPTF's guidelines of biennial screening between ages 50 and 74, with a mortality reduction of 23%. So what's the take-home message here? My personal opinion would be to start screening mammograms at age 40 and continue annually until your lifespan is less than 10 years. But definitely talk to your doctor about when they would recommend starting screening. Of course, that depends on which guidelines they follow, as well as whether you're considered normal or high risk for breast cancer. If you're interested in learning about what tools we use for breast cancer risk assessment, stay tuned for another video coming soon.